All right, let's get right into it. Deep inside your brain, there's this little stalk of tissue that connects everything, your thoughts, your memories, to the rest of your body. It's absolutely essential to life, but it's also unbelievably small and fragile. We are talking, of course, about the brainstem. And today, we're going to decode why this master control hub is so critical and what happens when things go terribly wrong.
And to really get why this is so important, let's just start with a fact that puts it all into perspective. Look, a stroke is always a major medical event, but a stroke in the brainstem, that's a whole different ballgame. It is, without a doubt, the most lethal kind of stroke you can have. The consequences are just devastating. And you might think something this bad has got to be incredibly rare, right? Well, not really. Somewhere between 10 and 15% of all strokes happen in this one tiny specific spot. So you've got this tiny piece of our anatomy causing a huge chunk of the most dangerous strokes possible.
Which brings us to the big question, the real mystery we're unpacking today. How can a little bit of damage in a space that's barely the width of your thumb cause such complete and utter chaos? Well, to figure that out, we've got to put on our detective hats and investigate the scene.
So let's start with the brainstem's main job. The best way to think about it is as the ultimate superhighway. Every single message, every signal going from your brain to your body or from your body back up to your brain has to travel on this one road.
So when we say it's a stalk, we mean it literally connects the big thinking part of your brain, the cerebrum, down to the spinal cord. Every command to wiggle your toes, every feeling of the sun on your skin, all of that information is flying through these densely packed nerve bundles. It is truly the body's information superhighway.
And this superhighway isn't just one long, uniform road. Nope, it's actually organized into three distinct levels, kind of stacked on top of each other. At the very top, connecting to the rest of the brain, you've got the midbrain. Right in the middle is the pons, and at the bottom, where it blends into the spinal cord, that's the medulla oblongata. Each part has its own critical jobs to do. But here's where it gets really cool. The brainstem isn't just a passive roadway for signals to the body. It also has its own highly specialized local exits. And these exits are responsible for controlling, well, everything from your shoulders up. This is where you really see how tightly integrated our head and neck functions are with this one little structure. So while those big superhighway tracks are carrying information for your arms and legs, the brainstem itself is the command center for 10 of our 12 pairs of cranial nerves. These are the dedicated wires that let you see, hear, taste, swallow, talk, and even just smile. They're the whole control panel for the incredibly complex machinery of our head and neck. Now just look at how this is mapped out. It's fascinating. You see the pons, that middle section? That's where the nerves for feeling your face and making you smile originate. Then you go a little lower, down to the medulla, and that's where you find the controls for swallowing, for your voice, even for moving your tongue. It's just this incredibly precise and organized system.
Okay, so now we have the two main pieces of our puzzle, right? You've got the body's superhighway and the head's local exits, all jammed together in this tiny space. Now, let's see how neurologists use that simple fact to solve some really complex clinical mysteries.
And this is the key. This is why a tiny bit of damage is so catastrophic. It's all about the density. You have all the wiring for your entire body running alongside the specialized wiring for your face, your eyes, your ears, your throat, all bundled together in a space no bigger than your thumb. There is just zero room for error. This quote from the source material just nails it. A lesion in the brainstem isn't like a lesion elsewhere in the brain where it might just take out one specific function. No, because everything is so jam-packed, a little bit of damage can't help but hit multiple systems at once. It takes out the local exits and the superhighway at the same time. So, how do doctors figure out what's what? Well, they look for a really strange mix of clues. If you damage the superhighway, you get what are called upper motor neuron signs, things like muscle stiffness and really jumpy reflexes. But if you damage one of the local exits, a cranial nerve, you get lower motor neuron signs, and that's the exact opposite. Muscles go limp and weak and can even start to shrink. Finding both of these contradictory signs in the same person is the giant flashing red light that tells a doctor the problem has to be in the brainstem, the one place where both of these systems run side by side. And this is where it gets really, really interesting. Because of this unique anatomy, the brainstem creates this very specific, almost bizarre pattern of symptoms that acts like a perfect neurological fingerprint for what's gone wrong.
All right, detective time. Let's look at a classic case called medial medullary syndrome. It's the perfect example to show how one tiny little lesion in the lower brainstem can create a clinical picture that seems, at first, completely impossible.
So here's the puzzle. The patient has a stroke. The doctor asks them to stick out their tongue, and it points to the same side as the damage in the brain. But their arm and leg are weak on the opposite side of their body. So how? How can a single tiny stroke cause problems on both the left and the right sides of the body at the same time? And boom, the puzzle is solved. It's all about timing and location. The lesion hits that tongue nerve before it has a chance to cross over to the other side of the body, so the symptom is on the same side. But it hits the motor and sensory superhighways after those pathways have already crossed over from the opposite side of the brain. The result is what neurologists call crossed deficits. It is the smoking gun for a brainstem lesion. So what keeps this incredibly dense, unbelievably important structure running? Well, like every part of the brain, it needs a constant, steady supply of blood. And the system that delivers it is, well, it's pretty unique and fragile itself. It's called the vertebro-basilar system. And what happens is two big arteries run up your neck, and at the base of your skull, they actually fuse together to form one single large artery. This network is the one and only blood supply for the entire brainstem. There is no backup plan. And that, of course, makes it a huge point of vulnerability. The vast majority of brainstem strokes are caused by things like blockages from hardened arteries or a tear in the artery wall, a dissection, happening right here in this one critical lifeline. Okay, so let's tie this all together. What are the big takeaways? First, the brainstem is that super crowded superhighway for the body and the local control center for the head and neck. Second, its incredible density is what makes it so powerful, but also so vulnerable. Third, that unique anatomy is what gives us those telltale crossed symptoms. And finally, this whole critical hub is kept alive by a very delicate and unique blood supply. It's just wild when you think about it. Everything that makes you you, your ability to breathe, to move, to feel, it all has to funnel through this tiny, delicate stalk. It really makes you appreciate the incredible, mind-boggling balance between complexity and fragility that exists inside every single one of us.